There is a complex relationship between thyroid disease, body weight, and metabolism. It takes a long time to discover this relationship. Thyroid hormones regulate metabolism in both animals and humans. Here on parshealthTV channel, we are going to take a look at the way thyroid manages metabolism. Stay tuned with us. To assess the body's metabolism, the amount of oxygen consumed by the body is measured over a period of time. If the measurement is taken at rest, it is called the basal metabolic rate, BMR. In fact, BMR measurement was the first test used to assess patients' thyroid status. Patients whose thyroid gland was not working well had low BMR, and patients with overactive thyroid gland had high BMR. Subsequent studies have shown that BMR is related to the level of thyroid hormones. When thyroid hormone levels were low, BMR decreased, and conversely, when thyroid hormone levels were high, BMR increased. Since then, due to the complexities of measuring BMR, most physicians no longer use BMR tests to assess the thyroid. They also found that several factors affect basal metabolism and that it is not the only thyroid that affects BMR status. What is the relationship between basal metabolic rate, BMR, and weight? A change in basal metabolic rate causes a shift in energy level. The difference between the number of calories consumed and the amount of calories burned by the body is called the energy level. In animals, if the basal metabolism is elevated by drugs such as amphetamines, the energy balance becomes negative, resulting in weight loss. Based on this research, many people have concluded that changes in thyroid hormone levels lead to changes in basal metabolism, which in turn upset the body's energy balance. And there are changes in body weight. Therefore, the relationship between metabolism, energy balance, and weight changes is very complex. In addition to hormones, besides thyroid hormones, some other proteins and chemicals play a vital role in controlling energy burning, appetite, and body weight. There are centers in the brain that control the regulation of energy consumption. Because these substances interact in the brain and tissues, we can not just consider one of these factors, such as thyroid hormone, and predict body weight changes based on it in general. As a result, we are not able to predict the effects of thyroid status on body weight in a specific way at this time. Hypothyroidism and obesity. Hypothyroidism is generally associated with weight gain because basal metabolic rate decreases in patients with hypothyroidism. However, compared to hyperthyroidism, usually in people with hypothyroidism, a reduction in basal metabolism has less of an effect on body weight. The cause of weight gain in people with hypothyroidism is complex. It is not always related to the accumulation of excess fat in the body. Most overweight people gain weight due to the excessive accumulation of water and salt. Excess weight gain is rarely associated with hypothyroidism. Depending on the severity of hypothyroidism, 2 to 5 kilograms of body weight can be due to thyroid function. How much weight will you lose after treating hypothyroidism? Since a large amount of weight gain in people with hypothyroidism is due to the accumulation of water and salt, it should be expected to decrease when hypothyroidism is treated. Like hyperthyroidism, abnormal treatment of thyroid hormone levels in people with hypothyroidism causes people to lose weight to their previous state, returning the weight they had before the illness. Again, if all of your other symptoms go away after thyroid treatment, the only problem with gaining weight is that you may be overweight. It's very rare just because of thyroid problems. When hypothyroidism is treated and thyroid hormone levels return to normal, the ability to gain or lose weight will become normal. If you haven't subscribed yet, please subscribe to our channel and press the notification bell. Can thyroid hormones be used to help you lose weight? In the past, thyroid hormones were used as a means to lose weight. Many studies have shown that using thyroid hormones leads to more weight loss than dieting alone. Still, when hormones are stopped, the excess weight is usually reduced and returns to its original. In addition, taking thyroid hormones to lose weight may have many negative consequences. Among other things, in this case, more muscle protein is lost than excess fat. Using or increasing the dose of thyroid hormones is unlikely to lead to significant weight loss, and may cause other metabolic problems. Hyperthyroidism and weight loss. Because basal metabolic rate increases in patients with hyperthyroidism, in fact, many patients with overactive thyroid will experience some degree of weight loss and slimming. This weight loss will be related to the intensity of thyroid activity. Therefore, if the thyroid gland becomes overactive, the basal metabolism will increase, and people will need more calories to maintain their current weight. If people do not increase their calorie intake to compensate for the extra calories burned, they will lose weight. As mentioned earlier, the factors that control our appetite, metabolism, and activity levels are complex, and thyroid hormones are just one of them. However, people with more intense workouts will experience more weight loss. Weight loss will be followed by fatigue and constant tiredness. Because hyperthyroidism increases appetite, some patients may not experience weight loss because they increase their calorie intake by eating more. Hyperthyroidism is a condition in which your thyroid gland secretes high levels of the hormone thyroxine. There are several treatments for hyperthyroidism. Doctors use antithyroid drugs and radioactive iodine to reduce the production of thyroid hormones. Sometimes treating hyperthyroidism involves surgery and removal of part of your thyroid gland, which can become a serious problem if left untreated. Most people respond to treatment when their hyperthyroidism is diagnosed. Symptoms. The symptoms of hyperthyroidism are similar to those of other diseases, so diagnose it with your doctor. It will be a little difficult, but it still has signs and symptoms that include sudden weight loss even when your appetite and diet are normal, or even an increase in food intake. Increases your normal heart rate to more than 100 beats per minute. Irregular heartbeat and sweating. Increased appetite. Anger and mood swings. Tremors are commonly seen on the hands and fingers. Changes in defecation patterns, especially increased defecation. Muscle fatigue and weakness. Difficulties in sleep. Your body naturally goes through changes as you get older. If you see a considerable difference in how you feel or how your body responds, talk with your doctor to notice whether a thyroid problem may impact you. If you're a woman over age 60, remember that you're at higher risk of a thyroid disorder. Feel free to share your ideas and experiences with us in the comment section below. If you enjoy the video, please share it with your friends, and don't forget to subscribe to our channel. And watch more of our amazing videos on the left and right of your screen.